lot of people have been mentioning to me that there's a process being used within the hospital that's called Choosing Wisely. And they start to ask me questions about this because they feel I should know a little bit about it from being around, but I don't. And I'd like to have some explanations that I could share with them.
It's really important that you know about this. This is really growing in momentum in Gold Coast Health, but also throughout Australia. Choosing Wisely is really, in essence, about supporting the conversation that happens between a healthcare professional and their patient. And the idea is that discussion that can happen in that conversation will help to make the best choice and the wisest choice for that particular individual. And that's really what it's all about.
So we need to encourage the people that are coming in to feel comfortable in asking these questions and getting the conversation going.
That's the magic that we need. We need to be able to allow people to prompt that question so that the conversation can be ignited, and that's exactly what we need to do.
So we've got many people who feel uncomfortable asking those questions because there's all sorts of people that attend medical institutions. So we need to work with them also from a community point of view in our social networks of encouraging them to speak up more.
I can imagine it's not that easy because I guess traditionally when people come to the hospital, the doctor or the nurse is there to tell them what's what, but that's something we need to change, and it's not working as well as it needs to. The problem we've got is that when things get really busy in the clinic or in the ward, and there are so many different tests to choose from and procedures to choose from, it can be very easy to revert to just ordering that next test or ordering the next procedure without actually stopping to take a moment to have that conversation. So for us, it's a moment in time where we need to look at a different way of forming that partnership. I had a case in my clinic one time where a patient was on some treatment, and in the room they were very happy, thank you Dr. Wellwood, everything's going well, but then they get out of the room and there's all sorts of questions that they had that they, for whatever reason, didn't feel able to ask. They didn't want to worry Dr. Wellwood. But in the end, they're the questions that would have been really important to help make the best choice for that patient. So I think providing better information in different ways and really understanding what it is that the patient wants to know.